Let's be honest. How many of us wouldn't like to improve the appearance of our skin, to counter the effects of aging, sun exposure, and gravity, and just to look young again?
I came to Dr. Lupo, gosh, probably 25 years ago, just for general dermatology, and over the course of all those years, developed a really close and trusting relationship with her. So when she brought up the idea of cosmetic procedures about 5 or 6 years ago, I was definitely willing to give it a try and have been really pleased with all the results.
This is the kind of story we hear from a growing number of people who want to minimize facial skin problems, wrinkles, scars, and blemishes, and those who simply want to not only just look younger, but natural and refreshed. The answer to a more youthful appearance does not necessarily have to be a surgical one. There are many non-surgical techniques today that can accomplish wrinkle reduction and facial rejuvenation. Lupo Center for Aesthetic and General Dermatology and Dr. Mary Lupo offer a variety of treatments which can achieve dramatic results without disrupting your daily life. And with so many options to choose from, the treatment can be tailored to your unique needs, lifestyle, and timeline.
My practice specializes in non-surgical rejuvenation. That means I use injectables, laser, light, and energy devices, and customized skincare protocols. My goal is to have a patient look like a rested, more youthful, and vibrant version of themselves, not to look different.
Tonight, we would like to focus on 2 non-surgical skin rejuvenation therapies. The first is the Fraxel Dual procedure. This dual wavelength system is a marvel of laser technology for effective skin resurfacing. Dr. Lupo customizes the intensity of the treatment level in accordance with the patient's needs, giving the patient a choice between superficial, moderate, or deeply penetrative treatments.
It is very important to me to invest in the safest and the most effective technology for my patients. Fractional rejuvenation using the Fraxel Dual and Restore for more severe cases, and the Clear and Brilliant and Permea systems for earlier cases of photoaging allow me to tailor the treatment to the specific needs of my patients.
Non-invasive injectable treatments are the largest and fastest growing category in aesthetic medicine. Dr. Lupo has always been at the forefront for both neuromodulators, such as Botox and Dysport, and fillers, such as Juvederm, Restylane, Belotero, Radiesse, and Sculptra. With real, noticeable results, no surgery, and no recovery time, there are many reasons why these injectables have been chosen by millions of women, men, and their doctors.
My experience with injectable rejuvenation goes back to 1983, when I actually started the resident program at Tulane to include injectables as part of the core curriculum for dermatology residents. And my experience has evolved and improved over the years as injectables have evolved and improved. I'm very proud that I was involved for the FDA study to evaluate Juvederm for approval, and I've been involved with the FDA evaluation of the treatment of crow's feet with Botox. These things have given me an edge in keeping ahead of the times with injectables.
Aesthetic procedures can boost your self-esteem and confidence, but be aware that it is not a guarantee of happiness. Successful aesthetic procedures are a result of good rapport between patient and doctor, trust based on realistic expectations, and exacting medical expertise. Dr. Lupo and her team at Lupo Center for Aesthetic and General Dermatology work with their patients to define their concerns, educate them as to options, and find a program that works best for them.
Over the years, Dr. Lupo has performed several cosmetic procedures on me, and anytime someone asks me what I've done, I always say whatever Dr. Lupo tells me to do.